My name is Paul Morgan from Austin, Texas. Flew out here today, very hopeful for this stem cell therapy. Discovered as a 44-year-old, I ended up rupturing one of the discs in my lower back, L4. Been quite painful, as you can imagine. So I've been living with that for about 3 months now. I've gone through physical therapy, several doctors, some specialists. Really got down to, for me, what became either live with it, which as a 44-year-old man telling my kids, I can't pick you up, daddy, be careful with daddy, that's not gonna last for me, right? Either live with that or, get a spinal fusion, which, mathematically speaking, 5 to 8 years later, I'm likely gonna get another one, and then another one, and by the time I'm 60, I've got half a dozen of them locked up. So that's not a real practical solution either. So started researching some alternatives. I have a really good friend of mine who's done a similar therapy. Actually had a worse condition. It was a decade old, had ruptured the disc in 5 separate places due to a weightlifting accident. So went out and had dinner with him. He had a very similar therapy done with stem cell injections, completely healed the disc with no residual side effects, no residual problems. So of course that's something I would very much like to entertain before engaging in something like a surgery there's kind of no going back for. So
let me ask you, Paul, if you were to have surgery, or if you were to have the fusion, in terms of cost, even with insurance, is that expensive?
Incredibly. In fact, I'm a good candidate to know that. I'm 44. I've actually had one surgery from C6 and C7. I had those fused when I was 19. So yeah, as I recall, that was about an $82,000 procedure with insurance. I don't know how much of that got paid for. I can only imagine what it would cost now. Of course, that did remedy the initial problem, caused some additional problems of the disc above and below deteriorating, which now I have to monitor the rest of my life. A lot less weight on my neck than on my lower back. So it's something that I'm not going to entertain unless it's an absolute necessary. So everything I've read, from talking with you, from researching the company, researching stem cell therapies, has very promising results, and quite hopeful for this being not only something to remedy a lot of my symptoms, but in fact be a permanent cure for that and keep me out of that knife.
Yeah, I so know what you mean. When you investigated other options, did you just come to Mexico, or did you look at other countries?
I did look at other places, including places like Panama and whatnot. There were a variety of things that I did find attractive about this operation, mostly because it was a very straightforward, very simple travel for me from Austin, Texas, one flight out here. You were very instrumental in finding me a hotel because, of course, I don't know anything about California. Got me set up with the hotel, less than a mile from the airport, was able to get a shuttle from the hotel. Transportation into Tijuana was all completely covered. Feel very safe in the area, which is of course one of your concerns. It's an unknown variable, right? Had a tremendous experience with everybody so far. Been very caring, very considerate. Checking out my MRI ahead of time certainly puts you at ease that you're not just getting a cookie cutter solution. You are still getting a solution that is catered towards your individual scenario. Really helps put you at ease. The entire process so far has been nothing sort of seamless, and very pleased with everything I've had so far.
Good. I'm happy to hear that. And one of the things that is very important to people is the cost. How
Of course.
do you feel in terms of the cost?
So I find the cost, the way I look at it is, what is the quality of life for not getting it fixed? So, I mean, on one hand, how do you put a price tag on your health, right? You spend so much of your time chasing money. What you don't want to do is build up money and then lose all of your money trying to regain your health. So both have to happen, right? That being said, cost is always a factor. I did find this to be quite reasonable for what I'm getting, and based on the results I think are reasonable to expect. Honestly, I find it fairly conservative on cost, to be 100% honest for you. I'm very pleased with not only the price point, but the service I get, and the results that, as near as I can tell, I'll be able to yield from it. So I'm expecting within a few months that this is not even an issue anymore. I can go back to lifting my kids. I haven't picked up either of my children in 3 months, And I can tell you from an emotional standpoint as a father, that is as worse or worse than the pain I feel in my back.
Of course.
I can't put a price on that.
How old are your kids?
13 and 15, both boys. I get home from work, they come downstairs, you know, Daddy, and it breaks my heart to say, okay, easy with Daddy, one hug at a time, one hug at a time. And honestly, the pain notwithstanding, that's the worst part of the experience and what I'm most looking forward to correcting.
Right. And boys are like wrestling and playing and pushing and
Yes,
pulling and jumping, and, right?
It's always been a joke with my wife and I that every game that we've ever played has been some version of what I call Hurt Daddy, because it's always rough and tumble and they're boys. And I enjoy that. And I haven't had it for 3 months. And I'm really looking forward to doing them up and throwing them on the couch again, which I have not done for 3 months.
Good. Well, thank you for your trust.
Well, I appreciate the ability of professionalism and the service that I've gotten down here, and I'm really looking forward to the results.
Good. Great. And we'll call you month to month. I'll be speaking with you. And maybe you can journal a little bit of your journey, where you see improvements, where maybe you're still short of improvements, because that's going to be really important if we continue a once a year program to know exactly where you are improving and where we're not. And that's where you and I will stay in touch and keep each other informed as to some of your expectations and what you can expect.
Yeah, and this is honestly something I would like to look at doing after we get this settled out. Maybe every year, every other year, just coming back for an IV treatment, maybe make it a weekend in San Diego, pop over for an IV, pop back.
Right.
I have pretty high expectations, and I don't find them to be unfounded.
Good. And we'll make sure that a doctor is with you every step of the way in terms of like determining whether that's a good fit for you. A lot of our patients just decide voluntarily to come back, right? Because like what you said is, we're degenerating over time no matter what.
Of course.
So why not regress or retard that as long as possible?
Absolutely. So for me, it really boils down to what is my quality of life going into the future? What does that look like?
Yeah.
And it was, I will say, instrumental, not only dealing with you by phone, you've been incredibly responsive, and also being able to speak with the doctor for close to 30, 45 minutes of his time, which I recognize as valuable, really helps put me at ease that this is a quite professional operation. I am overjoyed to find out that is in fact what's happening.
Did you feel rushed? Like, did you feel rushed, or like when you were talking to the doctor, like he's got to go, I have to hurry up and say anything?
At no time. I think you may recall I mentioned several times, like, hey, thank you for the time. That was because I recognize he's got other things to do. Certainly in America, my experience with doctors, and I love my medical system, but they've got to process people. What do you want? Let's get you out of here. I've got to see, 6 people an hour. At no time have I felt that.
Good. Again, thank you, Paul. We really appreciate you, and we'll be talking more.
Absolutely. Well, thank you so much. Really appreciate everything you've done for me. Appreciate it.
Good.